stopped all the steroid treatment. She stopped all the anti-cancer treatment. Her diabetes is under control. Maybe she had not got her entire hair because it was quite a big one, but now it is doing some pop cutting and all that. But she got back her entire color back. Well, it is amazing. It has infused tremendous amount of confidence in me as well as in my family members. After that, there are so many family members who have started taking this product, not for cancer, but of course for not getting cancer or for any other ailment as well. The other case where a group of doctors got convinced is a diabetic gangrene case. In Bangalore, in one hospital, there was a lady admitted, and one doctor who is an ENT surgeon, this was the very earliest case for me, and the ENT surgeon was treating this patient. It's a severe diabetic case, and she had a non-healing foot ulcer, developed gangrene. So the next course of treatment is only amputation. And that is the time we recommended to through another doctor friend, we got into connection with this doctor. What we recommended was take Ganoderma 4 pairs, 2 RGGL morning, 2 RGGL in the evening, and cleanse the wound with saline and all that. Then use RG powder as a topical usage, topical application, 2 times, morning and evening dressing. In 3 months' time, we have photographed that also. In 3 months' time, there was a complete healing, 100% healing. And that has convinced the doctors inside that hospital, the ENT surgeon. And after that, there is one gynecologist who has taken, her father had psoriasis, for a long time psoriasis person, and the person's psoriasis got relieved. Well, so many people, because that is the beginning of our doctors getting convinced of this product. So, like this, now today, if you ask me, there is a long list of testimonials we can say like that. People who have had, I know one person, one lady who had a kidney, dialysis going on. 3 times a week dialysis has now been reduced 1 time for 15 days. 1 time for 15 days. Now somebody asked me a question. No, it has not become zero now, doctor. See, it is very easy to ask a question like this. But a person who undergoes dialysis 3 times a week only can appreciate that she is undergoing only once in 15 days. What an amount of change and relief the person gets it. That's a very great thing that has happened. And in this, I would also like to mention, sometimes what happens? We go and talk about cures. We say Ganoderma is a cure. Many people promote this as a cure for many diseases. Actually, in my view, it should not be done like this. The reason is, what do you mean by cure? What is the meaning of cure? Cure means you should not get it back again. That is what is called a cure. Correct, no? Right. Now let us look at like this. I had appendix problem. I had appendicitis. So I go to a doctor. So doctor does an operation. So he removes the appendix organ. He throws off. So I will not get appendicitis in future because the organ is thrown out. 100% cure. Next time I went to a doctor with an asthma problem. Severe asthma. So doctor wanted to treat me. Doctor, before you treat me, you should give me 100% cure. No, how? No, last time I came, no doctor. Appendix operation. So you cut off the appendix organ and threw it out. So I must also get 100% cure for my lungs problem. So do you think that doctor will remove the lung and the heart and give it to you, put it in a showcase and see? So where is the cure? Oh, if it is so, that what doctors are doing? Doctors are doing relief. 99% of the problem is relief, not cure. Supposing a lady has got multiple fibroids becoming malignant in her uterus, then the doctors removed it by hysterectomy operation. By hysterectomy, you remove the uterus and throw it off. So you will not get into this type of problem again. That is a cure, 100%. Now, supposing I have a problem in my stomach. Now, I can give you 100% cure by removing and throwing your stomach. Then what will happen to me? So, these are all certain terminologies we must be careful enough in using it. When you use Ganoderma, it gives you a lot of relief. You talk about that. then it gives a lot of confidence. So don't go and talk to your doctor. Doctor, I'll tell you what doctor you are. You are treating same fellow for 20 years. No, I give you one, remove one, prevent, RG and GL. It cures everything. The doctor will not accept it. This is where our problem is. We must be simple. We should not be over enthusiastic in talking about that. So you talk more of relief rather than of cure. Oh, it's very interesting subject you are talking about. Very nice. You know this healing crisis. What I told in the beginning itself is, the person who comes to our DXN meeting, there are two type of people who come. Rather three type of people. One, a person with a disease, a chronic disease. I told you about a captive disease. So he has got long term, he has used some medicine, he has not been getting any result. So he comes there. Somebody has convinced him, he comes there. The second guy, he is like me, who has lost a lot of money into his business and then he doesn't know what to do. So somebody has told that you can make some good money in this system. Okay, he is the third guy, he doesn't have any of these two problems, but out of interest. Okay, somebody has convinced him that, okay, that guy may have good health, may have good wealth, no problem, but out of interest he has come. Now, look at like this. A person with a disease. Now I am assuming that I am having a severe asthma. Now a person coming and talking about this product, when you take Ganoderma, you get a healing crisis or an ailment reflection. What will be my first reaction? My first primary reaction will be, oh, when I take this product, I will get an ailment more. Oh, I will get a crisis. Now, crisis, this is a very, very strong terminology. When we talk about the healing crisis, when you talk about ailment reflection, I first get a primary thing is that if I take this product, I will get all these things more, or maybe some new thing will come, then after that it will heal. I think it is better to be away from this because already I am suffering. Why unnecessarily take fresh suffering? Now, this is not correct. That is my view. Now how to talk about simple? Everything is to be simplified. You have to dissect and see. In medicine you dissect and see everything. Now what is this Ganoderma? When you use it, what happens? Very simple thing. First of all, there is no side effect. You promote like, I do promote like this. First of all, there is no side effect. So the moment I say no side effect, the person who is listening to me, he gets a first confidence. My God, no side effect. Very good it is. Okay, my mind and my ears are open to listening to you. Okay, fine. The next, what Ganoderma does? It removes the toxin. Now when the toxin is going out, no, you cannot see the toxin going out. Oh, toxin, you look so beautiful. Very nice, you are going out. I think, why can't you stay in my home for some more time? You cannot say like that. Now when the toxin goes out, how does it go? It requires a certain medium. Now what sort of a medium? One is a water-soluble toxins by water-soluble medium, fat-soluble toxins via the fat-soluble medium. Now what is meaning by this? Very simple thing. Now you look at my literature. It's a very simple thing. I've given you the discharge of toxin. Please. Now, when the toxin get discharged, we are not talking of healing crisis. We are not talking of ailment reflection. We say it's a discharge of toxins. Water-soluble toxins via the urine, sweat and sputum. Supposing somebody is having, I am giving example. Suppose somebody is having asthma. Now what happens is that the stored toxins in your lungs, they get removed via the sputum. So the person may get a little cough. So somebody comes and asks me, sir, when I took Ganoderma, I get a cough. Oh, that is not a side effect. It is a process of discharge of stored toxin. This is what is very important. This is a critical word. The stored, your toxin accumulation gives you the problem. Ganoderma helps to discharge this toxin, and that gets reflected in your cough. Cough is not a side effect. Now the guy gets a confidence. Oh, there is no side effect. It's only a process of discharge. So you change your terminology from a complicated thing like healing crisis to toxin discharge. Like say for example, your fat soluble toxin will go via the motion. If somebody gets 1 or 2 motion, people with a little more weight or people with high cholesterol, if they pass 1 or 2 motion, there is nothing to worry about that, because that is the process by which the fat soluble toxins get discharged out of the body. Now when you do like this, where is the question of ailment, what is that reflection or healing crisis and all those things. So we do not want to complicate the matter for a guy who is listening. This is very important. That's why I say that be very simple in your promotion. You see, some people, if they take Ganoderma, see, somebody is also coming and telling, sir, let us say, for example, somebody says that he is getting a stomach pain. First of all, we don't have to become panic first. First thing is that, we become panicky. After taking Ganoderma, something serious has happened. Nothing serious will happen with Ganoderma. That is one confidence that we can give to people. Second thing, the skin rashes, it can be due to any factor. It can be due to any factor. For example, a skin rash can come even due to an insect bite. When he is taking Ganoderma, could be if he had got an insect bite, or if he is already having a skin problem, already an existing skin problem, let's say psoriasis case, or lichen planus, like that a lot of psoriasis, skin problems are there. Maybe some irritation, such type of transient problems. These are all not permanent problems. These are all called transient problems that can be treated with taking some medicine. For example, an anti-allergic medicine. I don't know the brands in Malaysia and all that. A couple of days, it can get relieved of. Stomach problem, may not be related to Ganoderma. Now we have to ask a question as to why his stomach problem has come. He is having an ulcer. Suppose he has got a peptic ulcer, then it could be possible that he is already having pain. And with the Ganoderma, he feels it's an increased pain. It is not so. Most of it, what they are attributing to Ganoderma, is not for Ganoderma at all. But then the problem, no, after taking this only I am getting it. This is what they say. Then you do one thing, you stop it for another 3 days. You stop it for 3 days and restart again. And after they restarted, sir, I don't have problem now. They're telling. So the question is not due to Ganoderma. Second thing is that, we should not jump to such conclusions. Our people have to be trained to say, no, this is an ailment reflection, you don't worry. No, the guy is not going to accept it. He's not going to accept it. So you talk them very simple thing. Did you have a problem? Ask them question. What a doctor, when you go to your doctor will always ask a question. There are 3 types of questions doctors ask throughout the world, irrespective of the country. First question, how long you have this problem? One is called the duration. The second thing, how severe is your disease? And the third question, whether the disease has spread from one organ to the other organ. These are the 3 questions eliciting the history of the patient. Now you also ask the same question, how long you have this problem? Then he says, I am having this problem for about 20 days. I say, before Ganoderma, after Ganoderma? No, before Ganoderma. Then you come to a conclusion, Ganoderma is not the one which produces all these problems. See, the question is, our people have to be trained. This is what I am emphasizing. Even in my meetings, I tell them. Now I will give you a small example. Somebody called up and told me, Sir, I have taken Ganoderma because one of your guy came and told me that if you don't have children, you can have Ganoderma.